Let's see. Now, the next speaker, we want to talk about the quality of life with sarcoidosis, and she is also a one of SRI's scientific medical advisors, Dr. Ogugwa Ndili Obi. She's pulmonary and critical care medicine doctor, and she's director of the Sarcoidosis Center of Excellence at East Carolina University. And as I said, she's going to be talking about fatigue and health-related quality of life in sarcoidosis. Dr. Obi, take it away.
Thank you so much, Pam, for that very kind, generous introduction. And thank you so much to SRI for the privilege of being a part of this presentation. All right, I think my screen is shared, so I will proceed and I'll be talking about fatigue and health-related quality of life in sarcoidosis. These are my disclosures, but none of these have any bearing on my talk today. And I've structured this to go through what I would consider the four key pillars of understanding fatigue and sarcoidosis in line with the goals of today's presentation to empower the patient's journey. I think knowledge is power, and knowing a lot more about fatigue and sarcoidosis, I think, will help patients, all of us, live better with sarcoidosis. And so we'll define sarcoidosis-associated fatigue and talk about why it's important to recognize this. We'll review the effect of fatigue on quality of life, discuss the causes of fatigue in sarcoidosis patients, and then review how to make a diagnosis and treatment of sarcoidosis-associated fatigue. And so what is fatigue? This is kind of like a dictionary meaning of fatigue. It's a state of extreme tiredness, exhaustion, or drained energy that is not relieved by rest and that impairs daily functioning. It manifests as a physical, mental, or emotional weariness, and it's often described as a feeling of being run down, lacking motivation, or experiencing brain fog. Now, sarcoidosis-associated fatigue is one of the non-organ or non-specific manifestations of sarcoidosis that Dr. Judson just talked about, where it's not necessarily related to the presence of those granulomas, those clumps or clusters of white blood cells or immune cells that Dr. Judson had talked about. But essentially, patients describe feelings of constant exhaustion, weariness, lack of energy, constant tiredness. My patients tell me they don't have a get up and go. They feel like they want to lay down all day. Several of my patients say it feels like I have nothing left. I have to push physically, mentally, and emotionally to get through the day. It's a constant struggle to work or even think. And it's like I'm living in a daze, like I have brain fog, like I just can't get myself clear. Now, fatigue can be physical, it can be mental, or it can be both. And so for the next few minutes, I'll take us through what we know about fatigue in sarcoidosis and why it's important to us as providers to know about, and important for you as patients to understand and have 100% grasp on. So fatigue is the most common and the most burdensome symptom of sarcoidosis. Now, this is a study from a center in the Netherlands that asked patients and their family members and caregivers to describe what symptom of sarcoidosis affects them the most. And you can see that fatigue was rated the most common symptom affecting them the most. Now, beyond looking at a single center study, it's important to look, broadly. And you can see from all the studies listed here that patients who have sarcoidosis generally feel more tired than the general population. And when we've surveyed large numbers of sarcoidosis patients, we can see that about 70 to 90% of them report fatigue. It affects patients in their prime productive years, and you see that even when patients are on therapy, with over 50% of patients on therapy reporting fatigue. Now, several studies have shown us that SAF, which is another word for sarcoidosis-associated fatigue, is not associated with your pulmonary function. So when the doctor does this lung function test, sometimes you can have absolutely normal lung function and still have severe debilitating fatigue. It's really not affected or related to radiographic, your chest x-ray or your CT scan imaging. So you can have perfect imaging and you can also have a really bad imaging and not have significant fatigue. And there's also no good correlation between the blood inflammatory markers, the blood tests that we run, and how severe or how bad your fatigue is, or whether you even have fatigue. Unfortunately, fatigue in sarcoidosis patients can persist long after their disease has resolved. And even when other organs, Dr. Judson talked about the lungs, the heart, the skin. So even when other organ involvement has resolved, fatigue can be present. And so this is a study that looked about 75 patients, with fatigue. All of them had resolved lung, and about 50% of those patients continued to have chronic fatigue, some up to 17 years after their diagnosis. And half of those patients who had fatigue had such severe fatigue that it was crippling to their daily lives. Now, fatigue in sarcoidosis patients is also associated with more symptom burden. Patients with fatigue have more shortness of breath, they have decreased muscle strength and reduced physical activity level, and they have a higher rate of not being able to do their daily exercises, or they have very poor exercise tolerance. Patients with SAF also have a lot more mental anguish. They are more likely to have depression and anxiety. They are more likely to report chronic pain, and they are more likely to report cognitive difficulties. Now, whether it's the fatigue causing these or the depression, anxiety, the chronic pain, and the cognitive difficulties resulting in fatigue, we haven't fully resolved, but we know that they really go hand in hand. One of the most important reasons why it's important to acknowledge and address fatigue is that it's associated with a decreased quality of life in patients with sarcoidosis. And that is affecting the quality of life in all domains. Now, just a quick word about quality of life. It reflects how you as a patient view your overall well-being, your physical health, your mental state, your social interactions, and your environment. And we can see that the presence of fatigue cuts across, results in decreased quality of life across all those domains. Now, what is even more impressive about fatigue is that it is the strongest, the most important predictor of decreased quality of life in patients with sarcoidosis. So this study looked at the relationship between patient symptoms and quality of life, and the four most commonly mentioned symptoms were fatigue, shortness of breath, diffuse pain, and exercise capacity. And of all those symptoms, fatigue was really the most important one in predicting a reduced quality of life in patients. I do want to highlight this study to show that fatigue matters a great deal to sarcoidosis patients. So this is a study that we did in conjunction with the Sarcoidosis Research Institute, and highlighted, you can see Paula as one of the co-authors, just, an example of how much her drive is to improve life for sarcoidosis patients. And this was a survey that we sent out to about 1,000 patients with sarcoidosis. I'm sure several people on the call here may have responded to this. And we asked them multiple questions. One of the questions we asked was, to what degree do you currently experience these symptoms as a result of your sarcoidosis? And 86% of patients reported fatigue, and 40% of those reported that they experienced fatigue a great deal. Essentially, it was crippling to them. And this is 1,000 patients all over the US. We care about fatigue because it is the most frustrating manifestation of sarcoidosis for patients as well as for providers. Now, up here, you can see a patient who's frustrated because her physician doesn't understand her fatigue symptoms. The provider is struggling to handle the fatigue because it seems like the patient otherwise looks okay, and you have an end result where the patient is unhappy, hasn't been taken care of, and the physician is frustrated. And so, what are the causes of fatigue in sarcoidosis? It is a complex, what we call a complex multidimensional problem. There are multiple causes of fatigue in patients with sarcoidosis. Several of those causes are related to the sarcoidosis itself, some to the ongoing inflammation, some not related to the inflammation, the chemicals that Dr. Judson had talked about. But also, there's a lot of non-sarcoidosis things or problems that do cause fatigue in patients who have sarcoidosis. And so the sarcoidosis itself can cause fatigue, whether it's organ involvement, ongoing inflammation, muscle involvement, or muscle weakness. Chronic fiber and small fiber neuropathy, I'll talk about those in a little bit. The presence of anxiety, depression, and stress, the psychosocial causes of fatigue in patients with sarcoidosis. Several patients with sarcoidosis also have additional comorbidities, several as a result of the steroids that they've taken for prolonged periods. So things like diabetes can cause fatigue. Underlying thyroid dysfunction, patients who have a low blood count and the high calcium levels that Dr. Judson had talked about can cause fatigue. Patients with sleep disturbances is a big cause of fatigue in patients with sarcoidosis, and then medications. Now, I'm going to talk a little bit more about several of these, but even though I won't go into detail about the psychosocial causes and the metabolic abnormalities, I do want to stress that these are some of the most common and the most debilitating and distressing causes of fatigue. All right. So what are some of the sarcoidosis related factors that cause fatigue? So the burden or the extent of disease. So several studies show that patients who have multiple organs involved tend to have worse fatigue. Patients who have sarcoidosis in the lung and outside of the lung also have worse fatigue. Those who have sarcoidosis in the muscle, the bone, and the nerves do tend to have worse fatigue, and that's because they have muscle weakness, whether it's affecting the rest of their body muscles or their breathing muscles. Also, patients who have sarcoidosis in their heart tend to have worse fatigue, a lot of it because of decreased heart function or heart failure. But I'd like to focus a little bit more on the role of chronic pain and small fiber neuropathy. And Dr. Judson had talked about that briefly. Now, up to 70% of patients with sarcoidosis have chronic pain. Typically, it presents as pain in the large joints, but you can also have just generalized muscle aches and pain. But there's a special type of this parasarcoidosis syndrome that it occurs in sometimes up to 60% of patients who have sarcoidosis, where the small fiber nerves in the skin become damaged. And patients present with this, what we call neuropathies. Essentially, they report burning in their hands and feet. And patients described it as it feels like there's ants just biting me. Light touch leads to exaggerated pain, and some patients just feel even the thought of, having the bedclothes on their legs is, causes excruciating pain. Some have inability to sweat or excessive sweating. Dr. Johnson talked about the irregular or the fast heartbeat. Some have chest pain, dizziness, skin discolorations, numbness, or chronic constipation or bladder dysfunction can be difficult to diagnose. Usually, we make a diagnosis with skin biopsy. Treatment can be challenging, but several studies have shown that patients who have chronic pain and this small fiber neuropathy have a very high incidence of fatigue and decreased health-related quality of life. Sleep apnea is a big one in patients with sarcoidosis, and sleep apnea refers to the obstruction of your airways during sleep. You can see the large tongue and the soft palate kind of obstructing the airways. And, patients snore, their oxygen levels drop while they're sleeping, and they wake up feeling non-refreshed. Well, several studies have shown that up to 60% of patients with sarcoidosis have sleep apnea. Many different causes could be related to the disease itself, likely also a complication of the medicines that we use. Steroids, make patients gain weight. and weight gain or obesity is associated with sleep apnea. But sleep apnea in sarcoidosis patients has been correlated with much higher levels of fatigue, depression, cognitive dysfunction, and decreased quality of life. And actually, treating sleep apnea improves both the sleep apnea and the symptoms of the sleep apnea, as well as fatigue in patients who have SAF. And this study showed that patients with sarcoidosis who were treated for their sleep apnea had a significant improvement in their fatigue score after 3 months of being on the CPAP therapy. Another major cause of fatigue in patients with sarcoidosis is medicines. But this is something that we need to be, it's a complex relationship and something that we need to be very careful about. So treating active sarcoidosis certainly improves disease control and can help fatigue, but fatigue can also occur as a side effect of the medications that we use to treat sarcoidosis. And so prednisone is usually the medicine that most people get as a first-line therapy for sarcoidosis. That should change, and Dr. Judson presented the recent position paper. But in this study, which actually Dr. Judson's group did, they found that patients who had received high doses of prednisone, which is actually not that high considering what we give our patients, but patients who had received about a cumulative prednisone dose of about 500 milligrams. So think if you've taken 5 milligrams of prednisone a day for like 3 months, that gets you to that 500 milligram cap. Those patients ended up having worse fatigue and worse quality of life. Now, a recent study looking at methotrexate as first-line therapy showed methotrexate was as effective as prednisone, but up to about 26% of patients also had fatigue, although it improved at the end of the study. And so really, the take-home point here is always review your medications with your provider. Prednisone is associated with a lot of side effects and toxicity, and even though it may help initially, over long term, it causes worsening fatigue, and our goal at all times is to minimize the use of prednisone, and beyond minimizing the use of prednisone, we want to completely discontinue prednisone. So I'm going to talk about some fun stuff. Now, we've talked a lot about fatigue, and there's lots of questions, I'm sure. So is there a formal test to diagnose sarcoidosis-associated fatigue? How does one get screened for SAF? I've tried to talk to my doctor about this. How can I bring this to my doctor's attention, and how do we approach treatment in SAF? So there is no way to make a formal quote unquote diagnosis of sarcoidosis. There is no test, I should say, to make a diagnosis of fatigue in sarcoidosis. However, there's a screening tool that we use, and that screening tool is called the Fatigue Assessment Scale. It takes less than 2 minutes to complete. There's 10 items that one would answer, and 5 of those address physical fatigue. The other 5 address mental fatigue. And when you sum all those up, based on your score, it can give us an idea of whether or not you have fatigue and how severe that fatigue is. And I would encourage all of us to bring this up when you go see your doctor, to ask, can I have a screening test for fatigue? And why is that important? Is that it's important because we need to acknowledge sarcoidosis-associated fatigue as a diagnosis, and acknowledge that it's as important as all the organ manifestations of disease. It can be screened for, and we can make a diagnosis. Now, how do we manage or treat sarcoidosis-associated fatigue? So the first principle is to acknowledge that there are multiple causes of fatigue in patients with sarcoidosis. So you want to identify and address all the potential causes, and it's somewhat of a flow chart. You've screened, you know you have SAF. Next, you want to see, is it related to my sarcoidosis, or is it related to other potential causes? And do understand that both can coexist. Now, you want to make sure that if you have evidence of active ongoing sarcoidosis that is being well treated, look at the medications. Do I need to wean prednisone down? Now, look for other contributing causes. most importantly, you want to screen for and treat depression, anxiety, stress. You want to address chronic pain and this small fiber neuropathy that I talked about. You want to acknowledge that other medical problems, things like low blood counts, low thyroid function, your adrenal glands not working well, either because of prolonged use of steroids, can result in fatigue. You want to make sure you check your blood calcium levels, make sure it's not too high. And then look at other things like diabetes and also look at all the other medicines that you're taking. So, well beyond medicines used to treat fatigue, lots of other medicines, beyond other medicines used to treat sarcoidosis, all other medicines that you take can also potentially cause fatigue. So, you want to make sure that we're addressing that. Importantly, you want to evaluate for sleep apnea because treating sleep apnea, if present, is associated with improved fatigue and improved health-related quality of life. All right, after you've done all those things, and if you still have persistent fatigue, or I should also say, in addition to all those, the practice guidelines, which were published about 4 or 5 years ago now, recommend that for patients with sarcoidosis who continue to have fatigue, after we've addressed, the sarcoidosis itself, pulmonary rehab or an exercise therapy program has been shown to improve fatigue. And so these are some studies that have shown that. In this first study, a 6-week of inspiratory muscle therapy showed that patients who completed the therapy had improvement in their fatigue as well as in their shortness of breath. Even patients who have pulmonary fibrosis or scarring in their lung, after about 2 months of pulmonary rehab, had improvement in their fatigue. And in this program, 12 weeks of supervised exercise training also resulted in improvement in fatigue, in anxiety, as well as in the shortness of breath. Now, it's important when you do exercise or pulmonary rehab that you pace yourself and you avoid this post-exertional malaise syndrome. So this is kind of like a push-crash cycle, what I call the roller coaster cycle, where you have a little bit of energy, you exert yourself, and then shortly 12 to 24 hours after that you crash, and it's the crash lasts for a prolonged period of time, and it seems like the exercise therapy causes worse symptoms than the fatigue, the sarcoidosis itself. And so the key here is to stop, to rest, to pace yourself, to break early, and to break function so that you have more of a leveled out energy overall level. Now, some behavioral interventions have also been shown to help fatigue. So in this study done in the Netherlands, Vivian Kalman and her group found that patients, about 100 sarcoidosis patients who were randomized to an online mindfulness cognitive program versus the usual care, which was really nothing much at all, that patients who completed that program of 30 minutes a day of mindfulness exercise, at the end of the 12 weeks, they had improved fatigue, improved anxiety, depression, and quality of life, and the effects lasted a fairly prolonged period. Now, where you've done the exercise therapy, where you've done the mindfulness training, and where you've corrected everything else, if fatigue persists, there are some small studies, 2 small studies that show that use of neurostimulants may help. Now, these are small studies, and we need larger studies to confirm this, but they are what I would call the last resort for patients who have chronic fatigue. And so to conclude, fatigue is the most common and the most burdensome symptom in sarcoidosis. It is the major driver for reduced quality of life in patients with sarcoidosis. Addressing fatigue should be a stepwise process, beginning with screening for sleep apnea and all other potential causes, including medications. And patients who have persistent fatigue may benefit from exercise therapy, pulmonary rehab, mindfulness therapy. Remember to pace yourself. And where all else fails, neurostimulants may be helpful. Thank you.
All right. Well, thank you so much, Dr. Obi. Appreciate that. Was looking through the Q&A, and there is one question here that I think would you could answer. Would you ever suspect some form of sarcoid in a person complaining of severe fatigue and normal labs? And what test would you do first if you want to rule it out?
So that's a good question. So we know that patients who have sarcoidosis tend to have a fatigue. It doesn't always work the converse. In other words, patients who have prolonged chronic fatigue, are they more likely to have sarcoidosis? It doesn't necessarily work that way. And I would encourage those patients to certainly, talk with their regular doctors and look at all other potential causes of fatigue and not assume that they do have sarcoidosis.
I know some people say that COVID has some of the same symptoms as sarcoidosis. So how would you determine which is which?
You're right, actually. That post-exertional malaise I talked about, that literature is actually coming out of the COVID world. So there certainly is the post-long COVID or the post-COVID fatigue. The I would say, I don't want to say good news, but the news or the story behind it is that COVID is actually fairly easy, I would say, to make a diagnosis of. And so that's something that can be tested for.
Okay. What, let's see. One question is why were methylphenidate and armodafinil chosen as stimulants of choice? And do you have clinical experience using other agents?
Those are the two medicines that have been studied. I have used both. I really haven't used other agents. Um, but the studies that came out of Cincinnati, Dr. Boffman's group, and I think that's, what was available at the time. I do think that over time we need to study, first of all, those medicines and have more patients enroll, do larger studies, because again, those were fairly small studies, and potentially look at other medicines or other neurostimulants, see if they are helpful in patients with sarcoidosis.
Okay. Okay, I think that that's the last one I see that's directly from your presentation. Thank you so much, Dr. Obi.